Hello. Today I have a patient named Valerie who has arthritis in both hands and has pain and difficulty bringing her hand into a fist. So we're going to make a peanut butter and jelly sandwich today and use some adaptive equipment to assist her in making a peanut butter and jelly sandwich with less pain and more ease. So I'm going to go over to the sink and wash my hands and put some gloves on. Okay, and then I'm going to place the gait belt on the patient. I'm going to have the loop end towards the medial side of the body. Bring the strap through the teeth side and then bring it back through the other side so that it holds on. Okay, so a couple options for assistive devices. The first ones that I want to show are the inexpensive ones that anybody can do with supplies that they have at home. So I have a butter knife, I have a regular sharp serrated edge knife, and then a regular sharp knife. A couple of options. The first option that I think is the easiest would be to take a wash rag and wrap the wash rag around the handle of the knife, and then take some Coban or some tape or anything that you can secure the wash rag around the handle of the knife to make it a wider handle. And this will allow for a bigger handle so that she doesn't have to come into as much of a fist. It also is a soft surface, and then you can still use the knife end. Another option as well is to go to a local lumber yard and get some foam tubing and place the knife inside of the foam, the center of the foam, and then run the Coban around to hold the knife in place. You'd have to squeeze it a little bit tight because the hole is a little bit big. That makes a size that doesn't force her to come into such a closed fist, but you can also open the foam and wrap that around the outside of the other layer of foam, and that makes an even bigger handle so that she can manipulate the knife with ease without bringing her hand in such a fist. You can even come up over the blade of the knife just to secure the knife in there really well. And I'm just using the Coban. Again, you can use tape, any kind of wrap that's going to hold that in place. So I went over the bottom and I come a little bit around the top, and I might even do more than that, and that secures a large handle so that you don't have to wrap your hand as far around the knife. That's a couple options to adapt inexpensively with supplies that you have at home. I also would provide Valerie with some information on arthritissupplies.com, and that's a website that's dedicated specifically to patients who have the diagnosis of arthritis, and they have many supplies on there that can be purchased. Amazon is typically the cheapest place to get any of these type of supplies, so if it's on Amazon, that's typically the cheapest. One example, for the second part of the process of opening the containers, there's a variety of different sizes of containers that you can buy. This one is the wide handle, so you don't have to come in. For some people, that does cause a little bit more pain to try to open it with the wide handle, and this is a smaller handle for the jelly. Right here on the table, I have a towel that's representing some Dicem. So if you place some Dicem underneath and then placed it on top, that would give you more gripping strength to open it. You also can use a hand towel or a smaller piece of Dicem, or cupboard liner that goes in the bottom of the cupboard is grippy, and you can cut a piece that perfect size and use that to try to open. You can lay your hand on top without spreading it so far and use the pressure of your whole hand and then wrap your fingers around to try to open the container. So that's a couple options. Another option that I found on Arthritis Supplies is it's called a MediGrip splint. And that is a splint for your CMC joint. A lot of people have arthritis in that joint or have repairs on that joint, and that will hold that thumb in place so that when you use it to use these tools that you have less pain. There's a variety of adaptive equipment online that is available that I will give Valerie. I printed a couple off. Here's a tool that you wrap around your hand so you don't even have to go into a fist. And I like this one because it's universal. The utensils can be slid into the end, so you can use a spoon, a knife, a fork, or any utensil with that one. Another option is pre-built up assistive utensils that you can order online too. There's a spoon, a knife, a fork. There's all kinds of other knives. There's one with a handle on top that you can hold that cuts this way. I just didn't choose that one because you do have to wrap your hand around it. And then the force going down may be a little bit too much for somebody with arthritis. So we're gonna make a sandwich. So we're gonna get the bread out. I'm just gonna use one piece for this one because I want to use my adaptive equipment sharp knife to cut the bread in half. And I actually am not even hardly holding on to this. I'm just wrapping my hands around and cutting that bread pretty easy. I've got my Dyson down on the table, and I'm going to use either a washcloth or a counter liner or another piece of Dyson to open the peanut butter and then to open the jam. So then I'm going to use my other assisted device that has the much larger handle on it to reach in and grab the peanut butter out and just place the peanut butter on the toast. And then use that same large assistive device to get the jelly and put the jelly on the other piece of jam. So I've done everything seated. If you can use a stool to conserve energy. You can use a stool at a counter height top countertop and just put everything on the counter. Or I used a cutting board and brought everything over on the cutting board so that it's all together. The nice thing about these two is you can wash the knife. You can keep this on and then just wash the knife, or you can completely remove this and throw the whole knife in the dishwasher. These type of assisted devices are nice because they don't have to be disassembled or assembled, and they can just be put right in the dishwasher. So again, I'm going to use my Dyson or my countertop covers to put the lid back on the peanut butter and to put the lid back on the jam. And then I would make sure that I provide Valerie with the information that is needed to order any supplies at home if she can afford to do that. And the arthritissupply.com has all of those, a variety for arthritis, not just for kitchen needs, for dressing, all kinds of stuff. So those are my assistive devices.